Hey everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. It's cough and cold season, and one of the common topics we always get asked about as pediatricians is how to deal with a cough. So today I'm going to be going through your most highly asked cough questions. So we're not wasting any time. This is actually going to be probably a two-part series because there were so many questions to answer. So let's get it started. How long can a cough go before getting evaluated by a pediatrician? Great question. And typically my word of advice is usually for a typical cough caused by a cold, you're going to want to make sure that it's improving or gone, resolved by 10 days. Any cough lasting longer than that should probably be evaluated. Personally, as a pediatrician, I also like to know trends. Is it better? Is it worse? Is it stable, so not changing at all? Is it dry? Is it productive? Is it worse at a certain time of day, like first thing in the morning or at night, or maybe after they've been running around? Those are all really helpful things to know. Now, another really important footnote that I want to mention here is you don't have to wait till your child's coughing 10 days to bring them into the pediatrician. Please feel free to bring them in earlier. In fact, as a pediatrician, I think it's really easy for me to actually compare a lung exam, let's say on day 4 of illness, to then day 11 that they're coughing. I can actually think back to how the exam changed. Is it improving? Is it worse? Has it differed in some way? And that actually helps with your clinical picture. So on that note, what is too long for a residual cough after a virus? So typically a cough, as we mentioned, can last up to 10 days. It usually takes about 2 weeks to improve completely. So I should be seeing a trend in the positive direction. Coughing less, it's not really interfering with their daily activities. But it's very important for people to understand that while coughs can linger, we don't want to completely suppress them because they are a protective mechanism. Now, if it's not improving by the 10 to 14 day mark, right? So 10 days or so, if it's not better, you should bring them into your pediatrician. Should be improved or resolved by about 2 weeks. So if it's not improving by that 10 to 14 day window, I'm probably going to definitely want to see them. We may be thinking of other illnesses, viral pneumonias, bacterial pneumonias, sinusitis, reactive airways, things like asthma, and sometimes even a habit cough. If you have questions about what a habit cough is, let me know. We'll probably be answering that in next week's video. How do I get my toddler to cover their mouth? Ooh, good question. I have an 18-month-old and a 5-year-old. My 5-year-old's really good. We've been working on this for a couple of years, but a lot of it is constant reminders, and it's reminders from everyone. So it would be me, my husband, other caregivers, so her nanny when she was younger, and in school, I know teachers are constantly telling children to cough into their elbows. So constant sort of reminding, but around that token as well, making sure you're providing positive praise and reinforcement when they do. So when they do cough into their elbow or cough away from others or sneeze away from others, make sure you're saying, great job, that was so good, so that they understand that positive reinforcement when they do the wanted action, that means a lot. Now, other things, modeling. So if you have a cough away, and then maybe you could make the, see, mommy coughed away so that her germs wouldn't come onto you. I think that's really helpful. Right now, my 18-month-old, she obviously has no concept of doing that. I have actually seen her try to imitate her sister, but that's more for like fun. If she does cough, oftentimes my older daughter will say, well, she's not covering her mouth. And I have to say, well, she's a baby, she's learning. That's why we have to continue doing it around her, but we can definitely try to teach her. So it's really helpful for us to try to give others the benefit of the doubt, especially if they're in school, for example. But ideally, you're going to want to model, praise if they're doing this, constantly reinforce, and then really the power of masks is so helpful because that was one way we saw less of a viral burden. One of the many things that was helpful was masks help prevent people from catching other viruses as well. So on that note, can my coughing child go to daycare? So we're talking about germs and how do we keep our germs for ourselves. This is a tough question because I want to answer yes and no. As we said earlier, cough in any illness can linger, and just because it lingers doesn't mean your child can't go to school, especially if their activity levels have vastly improved. But not just activity levels. I like to see a child fever-free, overall feeling very improved. They should be feeling almost back to themselves. The cough isn't hindering their ability to eat, drink, ability to play, run around. And if any of those things are present, it's really important to still keep your child at home because first of all, your child's not feeling up to themselves. Second of all, it's not really fair for the teacher to have to keep an eye on the child who's constantly coughing every time they run around and they're playing. That's something that needs to be brought to the pediatrician's attention so that we can kind of keep an eye on that and make sure there's nothing else underlying or going on. So overall, a cough here and there, while it's improving, getting better, I'm okay with the child going to school. But you have to remember, trying to practice appropriate cough etiquette, right? Trying to keep our germs to ourselves. And then very important to also adhere to the school sick policy. So for example, my daughter has asthma. When she gets a cold, that cough is pretty much becomes a feed-forward cycle. So we do go on her sick plan for her asthma medications. So I start that pretty early, and if I'm noticing that the cough is not really hindering her ability to do any of the other activities like run, play, sleep, eat, drink, then I'm okay with her going to school. But I definitely disclose to her teachers that, hey, I've upped her asthma medications because she's gotten over a cold. So she's no longer, runny nose, wiping her nose constantly or sneezing on others, and she's definitely not having a fever. If she is coughing throughout the day and it's hindering any of those activities that we discussed, I'd probably keep her home. All right, guys, let's do one last question. This one's gonna be pretty simple. Can teething cause a slight cough? No. Teething does not cause a slight cough. Teething does not cause a fever or a temperature above 100.4. Teething does not physically make your child ill. These are all things that maybe have been propagated in Facebook groups or on websites discussing health, but it's not true. Teething can potentially make your child more irritable and maybe less likely to drink, and if that's the case, please make sure you touch base with your pediatrician so we're able to keep an eye on the hydration status, rule out anything else serious, but teething should not cause your child to have a cough. Bookmark that, okay? Teething will not cause your child to have a cough. All right, guys, I hope that was helpful. On our second part, we're gonna actually be discussing more cough Q&A questions. If you have any questions below, make sure you comment them. I'll try to answer as many as I can in the comments. I hope you have a good week. Bye.